Hello everyone, this is Dr. Mubasshra. Today I will teach you how to study smart for your clinical medicine exam. First of all, know your exam. Know your enemy. You should know the pattern of your exam. How to start preparing? Set a time period. Set your target. Select the study material. Set an aim on daily basis. And I would suggest work smart, not hard. Exam is at your spinal level, not cortical. Practice as much as you can because practice makes a man perfect. Your reflexes should be sharp, your exam scheme should be slick, you should behave like you are well rehearsed and well prepared. You don't need to think much about the next step of your exam. There are certain schemes of examination which includes cardiology, neurology, abdomen, pulmonology and general physical examination. There are a list of books for clinical medicine residents to study. Oxford Handbook of Clinical Medicine, Cases for Paces, Gautam Mehta, Ryder-Meer, MacLeod, Davidson, Kumar and Clark and many more books. But I would advise don't waste much time on big books. Improve your clinical skills. Find your weakness. Identify the deficiencies. Concentrate on physical examination method and have good observation to identify those signs. Make logical differentials according to your findings and behave like it's second nature to you. The key to success to pass any exam: confidence, believe in yourself, study smart and practice smart. Improve your vocal skills and try to speak exam-oriented English and show some flexibility in the exam. Thank you for watching.